Hi friends, see this, the effect of coronavirus. See this one, coronavirus in China. Because it is mainly affected only in China, mainly. Okay, see, for that we are getting the new one. What is the name of the actual name it is given? It is 2019 novel coronavirus. See, let us see the one by one. See this one. Open it. The people are using the mask and kind of the different kind of the dressing also. See in this one. Coronavirus live updates from China. It is like a pe- people's war against deadly virus. The deadly virus is nothing but coronavirus. China has reported an increase in fatalities and infections as the virus has claimed over 565 lives. The number of cases are still increasing. See, this is all about the coronavirus outbreak. It is spread to at least 27 countries, including Germany, which means Europe also, and in Australia and United States. See, almost 28,000 cases have been reported in 27 countries, and it is declared by World Health Organization. See this one, World Health Organization. See, this country is saying that over 5,000 people are already exposed. Okay, due to the this one cruise by in the period of virus. What the actually this WHO reports it has given to the world. See this one coronavirus WHO reports on coronavirus 2019 and 20. See this one. See day by day every day they are giving the reports. This one it is just yesterday only, and this one is and day before yesterday, and like that. See every day from the starting of January 21st. Yeah. Mhm. To the February 5th. Every day they are giving. And see this one. You just click on this one. What is the report it has given? See this one. This one is actually the report it is given by WHO. Novel coronavirus 2019, 2019 and coronavirus situation report. This was the 16th report. It is given by WHO. See, situation in numbers, total and new cases in last 24 hours, only in the last 24 hours. See, globally, this many number of people are confirmed that they are already affected with the coronavirus, almost 24,000 people. And in that one, 4,000 people are, they are now like new people, they got affected by this coronavirus. And in the China itself only, almost 24,363 people are confirmed, and in that one 3,893 are new. So these people, 3,000 people are very severe, and 400 people are again the new people. See, almost 4,000 people are very much ready to live their lives. And in that one already 491 people are already gone. And in next 66 people are also there in the list. And outside of the China also, they confirmed that 191 cases are confirmed and 32 are new. And it is effective to not only China but almost other 24 countries also. And one another country is also there. And in these countries, one death has happened already. In China, if you come to the risk assessments, see, China is very high at risk levels. And in the regional levels also decide, in the global levels also, it is the only the point it is having very highest problem of coronavirus. See this one, a biggest circle is indicating this China is the main one which is affected with the coronavirus. And Australia also, this area. And in India also, somewhere like this place. And in the Nepal. And in the Korea, Japan, and Philippines, Malaysia, Australia, Singapore, Cambodia, and Sri Lanka also, and Arab UAE, United Arab Emirates, and then Italy, Spain, France, Belgium, and United Kingdom, and Finland, and also Russian Federation, and also the Canada and the United States. Like almost every country is affected with this one, coronavirus. You see in this one. For example, for why this much of a problem they are facing in the China? Because only China people, see, almost half of the country is totally blasted with the coronavirus. See, this much. That is the only reason the people are worrying very, very, very severely. This is very bad. See, what are the technical focus they are taking? Strategic preparedness and response plan and rescue requirements. See, they are having that strategic objectives like there should not be any human to human transmissions and including reducing secondary infections among the close contacts and healthcare workers, preventing transmission amplification events, and preventing further international spread from China, identifying and isolating them, and also care of the patients early only in the early time only, and also including providing optimized care for infected patients, identifying and reducing the transmission from the animal source, and also and the clinical severity and extents of transmission and infections. So these are all the different kind of things that having surveillance. See how many cases they confirmed as per the countries. This is the total number of cases they confirmed. See, if you see here, yeah, in the China only, I think this report is only in the China. Yes, they mentioned here. This report is only in the China. Hubei is the highest and affected area, like almost 17,000 people are affected in the Hubei, and very less people in the Xinjiang. So this is the what the different kind of effects. And Western Pacific regions like the China, Japan, Republic of Korea, and Vietnam, Singapore, Australia, Malaysia, Cambodia, Philippines. See, these are all the different kind of the people affected in different ways. And how many number of cases are confirmed and how many are new, and then how many cases travel history to China, and then confirmed outside of China. How many number of people are confirmed outside of China? See, these are the number of deaths they have. In Philippines, one person expired due to this. Also, United Arab Southeast region. Coming to the India, there are three cases of recognized. Okay, there are no new other cases. Nepal also one case, Sri Lanka also other case. And coming to the America, 11 cases were recognized. And See, this is the effect they are getting. Really, it's very bad. In every country, they are getting this one. See, this is the graph of date of symptom onset versus days of cases. How many cases they have got? See, only in between the 20 to 27 of this January, highest number of people are affected with the coronavirus, and now the number is it's almost like decreasing. The epidemic of coronavirus identified outside of China by data of reporting travel history on February. See, this is like increasing in order. Now outside of China, now it is going very fast speed. What is the advice you should get from that one? See, in the previous also we are having the two different kind of the coronaviruses like this one, MERS and SARS. So Middle East Respiratory Syndrome and Severe Acute Respiratory Syndrome. See this one. You should avoid the close contact with the people suffering from acute respiratory infections, and frequent hand washing must should be done, and especially after direct contact with the ill people or their environment. Avoiding unprotected contact with the farm or wild animals. People with symptoms of acute respiratory infection should be practice cough etiquette, maintain distance, cover coughs and sneezes with disposable tissues or cloth and wash hands. Within healthcare facilities, enhance standard infection prevention and control practices in hospitals, especially in emergency department. So these are the different kind of the things we are having from the like report. It is the report from the WHO. And also see, if you see here, they have given some kind of the information and also vaccines related information also there. See this one. See, routine vaccinations, diphtheria, hepatitis B. These are the different ones. Okay, only I think this one. Yeah, this is all about the coronavirus affected to all our world. Yes.